With summer right around the corner, some experts are sounding the alarm as the number of skin cancer cases in Canada are rising rapidly. In Canada, where the rates of many cancer types are projected to continue to decrease, melanoma remains a notable outlier. The number of Canadians receiving a diagnosis of melanoma each year continues to rise, more than tripling in the past 30 years. Risk factors such as your age, natural skin color, and family history can contribute to your risk. But there are things you can do that could lower your chances of getting melanoma and other skin cancers, such as practicing sun safety. I'm now joined by Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, thank you for joining us today.
Good to be here.
Now, just how common is melanoma and where do we stand right now regarding melanoma cases in Canada?
Well, melanoma is a type of skin cancer that comes from melanocytes, which are the cells responsible for producing melanin. In Canada, what we know that this year alone, we're going to have about 11,300 Canadians who's going to be diagnosed with melanoma. And unfortunately, statistically, about 1,300 of those Canadians are expected to die from melanoma this year. So what we do see is melanoma is still a very potent disease that we need to bring down as soon as possible.
And what do we know about the main causes of the increase in the number of cases?
What we see is usually it's attributed to increased UV exposure. So recreational sun exposure, spending more time outside can certainly play a huge role in it. Artificially doing the same thing through tanning beds also greatly increases our risk. We do see in Canada geographic variation. So sometimes we'll see more melanoma cases in the maritime provinces. And so we're looking at Prince Edward Island and Nova Scotia actually have the highest incidence rates. As you said as well, the risk increases with age because the cumulative exposure to UV radiation is what increases the risk.
And how are we doing in regards to treating melanoma? Despite the rise in cases, are we seeing the mortality rate go down at all?
I think we've seen significant improvement and progress with melanoma treatment there. Very broadly, the 5-year net survival for melanoma skin cancer in Canada is about 89%. But it definitely varies based on a lot of issues, including gender differences. And if we really look at it from localized melanoma to metastatic melanoma, localized melanoma, which is stages 0, 1, and 2, has a 98.4% survival rate. But when you look at the more severe metastatic melanoma, you're looking at a survival rate of only 22.5%. So despite all of that, we are seeing there's significant challenges and we are seeing improvements as well with the therapies, but certainly a long way to go.
Now, you mentioned differing gender rates. Do we have any data on how melanoma cases differ between men and women? And what do we know about why we are seeing a larger increase in cases in men?
Right, so we do see that melanoma incidences in general are higher than men. Men tend to also have a higher number of atypical moles compared to women. And we do know that the survival rate for men is also lower for advanced melanoma. We also see location differences for men. Typically, commonly, we see melanoma on the trunk, head, and neck. And women, we see it more likely on the legs and arms. So why is that? So the thought is that men do spend much more time in the sun on average. Men are less likely to use sun protection in general. Men's skin is actually thicker than women's and has a little bit less fat beneath it, which makes it more prone towards UV radiation. And also a lack of estrogen. So research has found that patients with high estrogen levels actually have better immunity to melanoma and therefore increased survival rates as well. And then the final reason really is something that we all suspect as well, which is men are less likely to go to the doctor. So if there are anything suspicious, they're less likely to have that checked.
Now, it's very common to hear people say things like, I don't need sunscreen because I don't burn. As a doctor, what do these people need to know?
I think what we need to know is melanoma is still one of the most dangerous types of skin cancer, and it's not just sunburns, it's really a cumulative exposure over time. So if I were to tell them something to just keep in mind, definitely keep in mind self-exams and the A, B, C, D, E's of melanoma. So A is asymmetry, B is border irregularity, C is color variation, D is diameter, less than, or rather greater than 6 millimeters, and E is evolving, meaning changing in size. So if we keep those in mind, the A, B, C, D, E's, we should definitely be very focused on skin lesions that we have.
Dr. Raut, thank you so much.
Thanks so much for having me.
All right, stay with us. Coming up after the break, we'll have more national and international news. Don't go anywhere.